Hi, my name is Awilda Michelle Luciano. I am originally from Puerto Rico. I went to school, medical training, and internal medicine residency in the island, then moved to Texas for the University of UT Southwestern to complete my fellowship in rheumatology. I've been in practice for the past 16 years in North Texas area, and I'm here today to talk about psoriatic arthritis and the chronic condition and how it affects patients. So psoriatic arthritis is a specific type of arthritis. It affects patients that suffers from psoriasis. Psoriasis is a skin disease that is characterized by redness and scales. And about 30% of the patients that have psoriasis will present with a joint problem and inflammation. Psoriatic arthritis is similar to rheumatoid arthritis, but it tends to affect fewer joints. Psoriatic arthritis can manifest in many different ways. The word arthritis means inflammation in your joints. So when we say psoriatic arthritis, we're going to see inflammation in your fingers, in your wrist, knees, ankles. Another one that is a very characteristic of psoriatic arthritis is that we can get inflammation in the tendons of your hand. So we see what we call sausage digits. So your fingers can get so swollen that look like little sausages. That in association with changes in your skin or nail changes where your nail can get brittle and break pretty easy can be seen in psoriatic arthritis. Some of the patients that suffer from psoriatic arthritis can have back pain. And that back pain tends to be a lower back pain. It affects the sacroiliac joint, which is that connection with the spine and your pelvic area. There are manifestations that are not only articular, meaning not only in joints, that we see in other parts. We call it extra articular or in outside the joints. And that could be inflammation in your eyes. The color part, your iris, can get inflamed. Your body can attack that area and create inflammation. We can see also other diseases associated like Crohn's disease, ulcerative colitis, and inflammatory bowel disease can be associated with psoriatic arthritis. So how is psoriatic arthritis diagnosed? There's no specific test. It requires a clinical evaluation. If you do have psoriasis, that makes it easier. And then we look for the typical manifestations of the arthritis. We also do blood tests, and if necessary, we do x-rays, MRIs. When it comes to blood tests, psoriasis and psoriatic arthritis are inflammatory diseases, meaning that if you do have it, you probably will have markers of inflammation that will be elevated. So we look for something called sedimentation rate and C-reactive proteins, which are markers of inflammation. It is important to say that they're non-specific, so they don't make the diagnosis. But if we have somebody that has psoriasis, inflammation in the joints, and elevated markers of inflammation, it's very likely that this is all caused by the disease psoriatic arthritis. How do we treat psoriatic arthritis? The medication that we choose to treat your psoriatic arthritis is going to depend on your overall health, the severity of your disease. If the disease is mild, we tend to use NSAIDs or non-steroidal. Most patients will require medications that are immunosuppressive. And we have different categories. We have the DMARDs, is the next step if the patients don't respond to NSAIDs. And there are medications like methotrexate, leflunomide that have proven to be very helpful. In some instances, patients will require medications that target the disease a little bit more specific, and those are called biologic therapy. They are very good and proven to help with skin disease and joint inflammation. To mention a few, we have medications that can be infused like Cimzia, Orencia, Simponi, Remicade. They all are very helpful and very strong in improving the inflammation and the patient's quality of life. Medications are not the only way to treat this disease. You are in control too. Lifestyle modifications, exercise, reducing alcohol, stop smoking are things that really have a strong that big impact in the treatment of this disease. Unfortunately, psoriatic arthritis is not a curable disease. It's a chronic condition. The good news is that we can control the disease and put the disease in remission by taking medications. Thank you for watching. I hope you learned something from this video. If you want to learn more about psoriatic arthritis, please go to lsarthritis.com and click on Conditions we treat. If you feel like you have psoriatic arthritis, it's very important that you get referred to either a rheumatologist or a dermatologist. Thank you.